Hi, I'm Paula Stewart and I am the service manager at our residential service, Wernham House. We provide 24-hour care and support for 17 service users and specialise in working with alcohol dependency and mental health. As a residential care facility, we have a duty to comply with all government guidance. One of the main challenges is ensuring that our service users understand the guidelines. Many of our service users have varying degrees of cognitive impairment, therefore requiring regular, clear and concise explanation of the government and local procedures, what they are and why they're in place. There's been many changes over the last year on how we have operated within Wernham during the pandemic. We carry out weekly staff testing to ensure the safety of all service users and staff. We ensure our service users can still be supported by other agencies throughout facilitating online meetings, reviews, NHS attend appointments. Service users and staff are required to wear PPE and to comply with socially distancing where possible and work with all relevant guidelines. Staff wear PPE when carrying out most tasks around the project, and there is the increased requirement around hygiene and infection control. This is something that our service users have actually adapted to very well. Well, indoor and outdoor visiting has been prohibited during large parts of the pandemic. We've put an increased focus on providing support and companionship to our service users due to social isolation. We do this in many ways, including facilitating activities at a safe social distance around the project. In one instance, a service user who enjoyed family visits has been required to shield due to an underlying health issue, and we've had to ensure that any feelings of isolation or loneliness are recognised and addressed. Despite the many challenges our service users and staff have faced, the support we've provided has continued to have a very positive impact on our service users. For example, a service user was admitted to Wernham at the beginning of the pandemic and they were consuming over a litre of vodka daily, had multiple health issues, could barely walk, and a speech impediment caused through anxiety. This person doesn't actually remember their first 2 weeks with us. However, after a lot of hard work, support and determination, they've now been abstinent from alcohol for 100 days plus. They're only weeks away from returning to their own tenancy and have a real sense of self-worth and a fresh outlook for their future. I would say the hardest thing for our service users during the pandemic has probably been the social isolation, but also their understanding of how serious the pandemic has been. From a staff point of view, it has been difficult seeing the people we support suffer from increased anxiety, confusion and mental health deterioration. I've learnt that our service users and staff are a lot more resilient than they give themselves credit for. I feel that most people have a newfound respect for just how fragile life can be. On a personal level, I've watched the service users adapt and concentrate on the here and now. Our staff team have all pulled together and supported not only our service users but each other, because it's been tough for them as well. Thank you's not enough, is it? But I would like to thank everyone who supported Aberdeen Sardinians during the pandemic. If we didn't receive the amazing support from the community, it would be very challenging for us to support our service users. So thank you.